I'd firstly like to acknowledge the traditional custodians on the land in which we are meeting today, and I pay my respects to them, their elders, past, present, and emerging, and to any Aboriginal or Torres Strait Islander people that might be here with us today. I'd like to extend a warm welcome to Dr. Morgan Farley. Dr. Morgan Farley is an exercise oncologist, founder of Valere Health, and a researcher dedicated to helping people with cancer feel stronger and better during and after treatment and improving survival. With a PhD in exercise oncology, her work focuses on using exercise as a safe and effective way to reduce treatment side effects such as fatigue, improve quality of life, and support better treatment outcomes and survival through harnessing people's immune system. In 2018, Morgan founded Valere Health, a Brisbane-based exercise oncology clinic, and the only specialist clinic of its kind in Queensland dedicated exclusively to supporting people with cancer through exercise. Through this service, she and her team have helped hundreds of individuals undergoing treatments such as chemotherapy, immunotherapy, hormone therapy, and radiation therapy that use exercise as medicine to manage side effects, maintain strength, and improve their well-being during treatment. Alongside her clinical work, Morgan is an award-winning early career researcher and a research fellow at the Royal Brisbane and Women's Hospital. Her research focuses on supportive care approaches that reduce symptom burden and help people respond better to cancer treatments. She's passionate about translating research into practical, easy to understand strategies that empower people with cancer to use movement and exercise to support their health recovery and long-term outcomes. Over to you, Morgan. Thank you.
That was a lovely introduction. So I don't think I need to say any more about myself, but I did want to just start that I want today to be as interactive as you all would like it to be. So feel free to put your hand up, feel free to answer questions. I hope it feels like it's sort of a safe space where we're all here to learn and can learn off each other. So please feel free to join in. But in case some people don't want to be joining in with a face to name, I have set up a few Mentimeter surveys throughout where you can anonymously answer some questions and we can just talk through those answers as well. So the first thing I will do is share my slides. If you scan that QR code on your phone, enter at menti.com and use that code, or you can just answer out loud. I don't mind. What does fatigue feel like for you? How would you sort of describe it or explain it to someone that's asked how you're feeling? Live results should come up, but I will also. Oh, there we go. Yeah, worry, anxiety, tired, exhausted. One really common explanation I get too is like there's something that sits between my brain and the rest of my body, and I can't get out what I want to get out. Heaviness over the eyelids that just won't shake or won't budge. And something I think being cancer specific as well is I hear this and we hear this every day because it is such a common, it is the most common side effect from cancer and its treatments. And it's different from just being tired from a busy day. And I think recognizing that and giving yourself some grace for it and not just trying to push through like we might have done prior to diagnosis can really help start making some progress, because I'll talk a bit later on something I call the boom bust cycle, where you just keep pushing, you just keep trying, and then you fall in a heap and maybe not do anything for a couple of days, and then you keep pushing and keep trying again. And that kind of creates this seesaw where we're not moving forward in our capacity. So the first thing I do kind of like to just chat about and help people recognize and feel is that it is different and it is significant, and it is a bit about recognizing that and starting to use some tools within this normal that you're experiencing at that point in time. So we can revisit some of these results, but the next one we have here is just what does fatigue stop you from doing? Here we go. It's coming everyday activities. There we go. Doing what you want to do. So I think even writing down some of these things for you can help set a few small goals on and help recognize, and you'll see why I'm going through this later on what steps we can take to then try and overcome and improve some of this, because I'll talk a bit about activity pacing and activity prioritization. So, some of these things that are popping into your mind as the most concerning or the most debilitating or most upsetting for you, these are some of the targets we might set to overcome. And the last one here is I just wanted to get a bit of an idea of what you wanted and were hoping to get out of today. Because if I haven't answered it, I'll make sure I come back and answer it at the end. And feel free to add to this as I talk as a bit of a question point, and I can revisit it at the end. So you don't need to remember it in 10 slides time because I struggle to remember it at the best of times as well. So revisit this one. And so, just then, a little bit of background so you know where some of my recommendations and experiences are coming from. Alison already did a really good job of introducing me, but I founded Valere in 2018 after my grandma had cancer, and she was basically told to rest and do nothing. And I thought, well, she's 80. My granddad had already passed away from bowel cancer, and if she stopped doing anything, I didn't think she would start again. So I was still at uni, but I exercised her throughout, and her oncologist said, I can't believe how well she did. Can I send more people to you? And I said, well, wait till I finish my degree. And then I couldn't find a job within oncology, so I created Valere. And since 2018, we've worked with over 1,000 people with a cancer diagnosis. And why upper GI and pancreas is so close to my heart is the beautiful Jules, who some of you may have heard about. How good is Jules? And he was a key person that helped me build and turn Valere into what it is. And I like to honor sort of the advocacy that he did and the support that he had for me and everyone at Valere by helping to give back to people with upper GI cancers. So please never hesitate to reach out and ask questions. If you scan that QR code, it'll go to Valere's website, and the email that you'll find, I'll get to see it, and we'll make sure we answer as well. So, as I've already touched on, it's not ordinary tiredness. So, cancer-related fatigue is something that is annoyingly always there. It varies day to day, even hour by hour. Sometimes it can be consistent. You might know you always have a good couple of hours between 10 and 12, and then worse in the afternoon. But sometimes it can be really, really unpredictable. I'll talk about some strategies to try and make it a bit more predictable, though. And it's often multiple dimensions. So it's not just that your legs are tired or that your arms are tired. It's got that physical element, but it's also got that cognitive element. And then also emotionally, it's depleting as well. So it's got a lot of moving parts, a lot of multiple effects by it. And so, because of its multi-dimensional nature, it can have many causes or many things that interrelate to contribute to it. And I really like to draw these to attention, and there'll be a couple that will pop up because sometimes we have to exclude other causes, or sometimes we might need multiple strategies to help manage it. So, the cancer itself can cause fatigue, the treatments themselves, the chemo surgeries can cause fatigue. Then the individual side effects. Fatigue is one, but there's the other things like pain. I'm thinking most of you will have been on a steroid at some point, the sleep disturbances, different medications that are then given to manage it. Changes in bloods can all then contribute to further fatigue. Anxiety and low mood can contribute to feelings of fatigue. Deconditioning loss that's associated with cancer and its treatments. And then the physical activity on top of that can further contribute to it. But there's three things that I work with my clients on to manage at the same time as adding in the movement and exercise. So the first one is the reduced appetite that particularly upper GI and gastrointestinal cancers can cause. So that's some of the nausea, the either constipation or diarrhea, reflux, even any oral side effects as well. So if you're eating less, you've got less fuel to give to activities. So that's where I do look at referring to a dietitian or educating, making sure you're eating around sessions. So a lot of my clients find a go-to snack that they know they can tolerate. For some people, it's not like a sustagen or one of the hospital prescribed nutrition supplements, but it might be some form of protein or plant-based protein with water or a little bit of milk and a piece of fruit is really common. But then some people hate that and hate the liquid form. I've got one client that needs bland food and they literally have shredded chicken breast that they put a little bit of mayo on and have that immediately after they do their exercise. So making sure fueling is appropriate. And if it's not, because of some of these side effects, working to fuel, because that will A, help fatigue, but B, help you do more exercise and more movement that will itself improve fatigue. Another big one is anemia, so low blood count, so low hemoglobin. Having, particularly if you've come off chemo where you might have been getting a blood test every week or every fortnight, checking in on that because it's sort of a huge contributor to feeling fatigued, and it can often be a really simple fix. And then if there are any other underlying issues, so just having some regular blood tests, check-ins to make sure there isn't something maybe non-related to cancer that could be contributing to fatigue. I had one lady that was just not improving at all, no matter what I did. And I ended up writing to her oncologist. She got a full set of bloods and her thyroid function had declined, very unrelated to her cancer. And then when she went on some thyroxine, all of a sudden her energy picked up significantly. So just being aware that there could be some other things contributing to your fatigue, not just cancer and your treatments, that can be simple fixes and can make a world of difference. And so things for you to think about and things for you to consider is, has all of a sudden my fatigue gotten worse? And that might be a change in bloods or something else to consider. Have we looked at any other causes and ruled them out? Am I losing weight or struggling to eat? Has something changed in my life that might be external to cancer, like returning to work is a really big thing that spikes fatigue. A lot of my clients get more fatigued around like significant events, like around Christmas time, where there's lots of social engagements, catch ups, running around. And how am I going emotionally? So, if you do feel like you're struggling mentally, whether it's something cancer related, whether it's just life in general, this can also cause a bit of fatigue and help understand and then help us target some tools to help improve it. So, what now then? What if we've ruled everything else out? What if everything is just as your current standard is? What can we do to improve and manage this? So, my next question for everyone, and you may have clicked through, is just so I know how and what level to pitch my recommendations and sort of advice to, do you currently exercise or move? And what does that look like for you? Feel free to speak up and put up your hand as well. If you do want to put out there what you do currently and any strategies you might currently use to help do some movement, even with the fatigue. There we go. Water exercise in a pool, walks, great. So both some sort of more aerobic exercise based, walking, wonderful. Gym, great. I was hoping at least one person came in with a bit of strength training. So, looking then at management strategies, the three things that I sort of work with people on when fatigue's our big primary concern that we're working with is first educating around activity costs. So the next couple of slides will speak to this, but everything we do takes an amount of energy out of what we have available. And so sometimes when we're really in the depths of fatigue, we need to prioritize some of the activities we need to do. And sometimes we do need to say no to things to avoid this overcommitting, overdoing it, and then being bedbound for a couple of days while we recover. It's then once we prioritize some of those activities, have a bit of an understanding of what activities kind of use what energy for you, pacing those activities. So instead of trying to fit everything in on one day, it's okay, this week I need to do these 10 things. Let's spread them out throughout the day. And I work with different ways suiting different people, but a really common way we look at this activity cost pacing is step counts. Some people find step counts kind of quite representative on their watches or their phones of how active their day has been, because activities that cause fatigue, and I think you will all resonate with this. It's not just exercise and physical, it can be mental, it can be the incidental walking between cars to hospitals, walking around a shopping centre. That all adds up in a day. And as I have already addressed, fueling, we need to make sure we're putting energy in our bodies to then give energy back out. Then we want to build capacity in these activities. And this is where exercise and movement becomes really, really important. So, as I mentioned, it's not just physical movement that costs energy. And this is what some people, I think, don't often think about is we have our physical tasks that I think is what people often associated with not having the energy to do, like showering, cooking, grocery shopping, cleaning, gardening, exercise and walking, driving, stairs. But we also have these cognitive and social domains that sometimes get put in a bucket of that doesn't take energy, but it does. It's exhausting talking to people and listening and responding. Reading is also something that I have learned pretty early takes energy. I would have people sort of say, my fatigue's really bad. All I did was try and rest, but then they read and they did crosswords, which, yes, it has lower energy demand than gardening, but your brain is working and your brain needs energy to work. And social is kind of a big thing. I had a client just yesterday, and his wife came in with him for the initial assessment and said they had a visitor. He's recently been diagnosed that ended up staying for 5 hours. And then her husband didn't get out of bed the next day. And she was sort of asking, when should I say stop, leave, so he can rest? So social takes energy as well. And now I'm going to start talking a bit about a bucket. So all of these elements all draw from the same bucket. So activity pacing and managing your fatigue, this all comes from the same bucket and has elements of these. So it's not just about managing how much you do physically. We also need to look at what you're doing mentally and socially. So I have this kind of analogy. You may think, Morgan, I have no idea what you're talking about. Or you might think, actually, I get that. So everyone has this bucket of energy. And now, through everyday life, not with a cancer diagnosis, our buckets of energy change depending on time of year, what we have going on, how much sleep we're getting. People's buckets can change from day to day as well. But what also contributes to this bucket is how efficient we are at doing the activities within that bucket. Now, say there is a cancer diagnosis or another form of traumatic event, our bucket total volume that we have of energy now reduces and changes. Not only that, particularly when we're talking about cancer-related fatigue, our efficiency at doing the activities, and this is more particularly those physical tasks, now becomes less. So what I mean by that is if you have reduced some of your muscle mass, reduced some of your fitness, because the drugs and the treatments can do that to you, but so can resting, you then say walking around a grocery store, doing your shopping, pulling things off shelves, that used to take only 10% of that bucket, so only a little bit. But now, because we're a little less efficient, it actually takes 30% of that bucket. So not only is your bucket smaller, but the tasks that used to take 1%, 2% now take 10%. So we have room for less tasks. And where movement and exercise, it's an important for a lot of things, but really comes in is building this efficiency and then building this bucket back up. So then those everyday tasks start costing less, like stairs might start to feel a bit easier, gardening might start to feel a bit easier. So we'll talk a little bit about this in the next slides, but if you were my client coming to us for an initial assessment, really struggling with fatigue, we'd get you to do a bit of an activity diary to start with. So writing down roughly what you're doing in a day. We also get you to write down potentially step count and how much sleep you've gotten, and then any sort of key thing, like if it's been a treatment day or what stage of your cycle you're at or how many hours you spent at work if someone's transitioning back to work. Then we get them, and I'll show you this on a next slide, to write kind of how exertional you felt that task was. So after that task finished, did you think it was like 8 out of 10, 10 out of 10 being your max effort versus 0 being laying on the couch doing nothing? And then that helps to start actually seeing how much energy tasks in your day sit. And then we do a bit of an overall rating at the end of your day to see how much energy you feel like you've got left and how much energy you then wake up with. And I always say if you're waking up with less energy than you finished the day before on, you've done too much that day before and we need to take something out. And then that's where prioritizing what you've got to do in your sort of daily, weekly, monthly life helps figure out what we need to try and take out or reduce. And so this is, I mentioned earlier, a bit of a boom bust cycle. And what I find is this blue here is kind of energy level that you've got available. Up in that green zone is good energy, high levels of energy, or I guess I'm not a huge fan of this word, but more normal or pre-diagnosis levels of energy. And then down in this navy blue is kind of where a lot of people sit on a day-to-day basis during cancer treatments and even post-cancer treatments. But what I find is people will have better days and they'll try and make up for what they did the days before by doing a few extra activities, or they just don't want to say no. And they have these big days full of lots of things. And then they end up crashing and needing a day of rest or an afternoon of nothing to catch up for it. Then they'll recover a bit, they'll feel a bit better. So they'll make up for what they've lost. And it keeps ending up being this big up and down cycle. And so if this light blue line here is what an optimal kind of area zone is, they never sit in it. And we never have room to build on it because we're almost constantly chasing our tail. So by doing some of this activity diaring and pacing, we figure out where our thresholds are, what we can fit into that. And then by pacing our activities and adding in capacity building activities. So whether that is making room for a dietitian appointment to eat a bit more food, or making time to do even a 10-minute walk every day or a 10-minute strength-based session every day, where then fitting it in our optimal activity zone without these big spikes and crashes. But we're also then slowly building our capacity. So all of a sudden we have more, we are sitting in a higher zone. We have a bigger bucket to work from. Is this something that you kind of feel you resonate with? If you've never thought about any triggers or you think it's a bit unpredictable, that's where writing it down for a week might help you figure out, oh, actually, there is a pattern there. Every time I, go to an extended girls' lunch or half a day of golf or do my grocery shopping, I end up crashing the next day, and then we can start to manage it. So I have kind of already touched on what's here. So this is talking about this fatigue energy diary. This is an example of ones that I've done with clients where they just write down kind of physically what activities they're doing and then cognitively what activities they're doing. At the end of the day, how they felt, and then anything. I have more columns, but this is then I have a sleep column normally, just generally how you felt, what steps were done, and then was it a treatment day and things like that. So that can be really useful. And the other time this diary type thing is really useful is I often have people coming in and saying, Morgan, my fatigue's still not any better. I'm exhausted. But they're all of a sudden doing they may have returned to work, or they may have joined a gym and going to the gym every day. So they feel like their fatigue isn't any better, but they're doing so much more, which is quite a natural progression. Is as your energy improves or as you get further away from, say, the end of a treatment round, you start naturally just doing more. And without realizing it, yes, you feel like the fatigue is still really bad and you're really exhausted, but you're actually fitting more into your day before you get that same level. So this diary can also help people realize progress when they think they're not getting anywhere too. So doing it every couple of months, I feel helps as well. And then the last thing before we get on to, okay, you've convinced me I need to do some movement, is that fatigue feeds itself a little bit. So cancer, cancer treatments can cause fatigue itself, as I mentioned, but they cause all these other side effects. And what some people don't think about is that then these side effects can actually further contribute to fatigue. So, say you're on some steroids or you're in some pain, you might have some diarrhea symptoms and you're not sleeping well. You also then have some pain and some inflammation. You'll then have some fatigue and you're getting more and more inactive as this goes on. You then lose some muscle, you get a bit deconditioned because you're spending more time resting, and then your fatigue gets worse. And then you're still not sleeping. So we have this cycle that occurs independently of each other, but it occurs as a result of each other. And what we need is to try and break this cycle because physical inactivity is, it sounds counterintuitive, but it is one of the worst things that you can do to manage fatigue. Yes, that activity needs to be, as I mentioned before, really specific and within the realms of possibility. But inactivity and nothing has been shown in the research to be the absolute worst thing that can be done. Because then physical inactivity can further contribute to some of these side effects, which then causes inflammation, which has been associated to other cancer outcomes, but further fatigue that then results in more inactivity that keeps this cycle going as well. So we need to intervene to break this cycle. Exercise and movement has been shown to be the best intervention for cancer-related fatigue. And I know it sounds counterintuitive, and we will chat about how to do this without causing more fatigue, because you're right. If you do too much, it will make you more tired and more exhausted, which is why working with an exercise physiologist with experience in cancer can help you navigate this at the start. That then helps you be a bit more self-directed. So we have two really big cancer bodies across the world. For us, it's COSA, the Oncology Society of Australia, and then ASCO is another one, so the American Society of Cancer. And they've both released position statements recommending that exercise is one of the most beneficial tools for fatigue, and exercise should be included as standard of care. And this ASCO guideline on the management of fatigue has exercise and movement as the number one priority. They also looked at things like supplements, and they didn't have any effect. The other two things in this guideline is mindfulness-based activity, and then also doing some sort of more like yoga-based exercises. And then the next one was a bit of psychology, cognitive behavior therapy as well. But I won't go into those too much because A, exercise and movement was the most effective, and two, I'm here to talk about exercise. So you might be thinking, I'm already exhausted. How can I do more? And that's where it's not necessarily about doing more. It might be being more targeted about what you're already doing, or thinking when we're prioritizing our activities, exercise and movement isn't just sort of a nice to have. It's something that there is evidence for that might change my clinical outcomes and change my fatigue. So it needs to be maybe a slightly higher priority than something else on your list. So why exercise can help? It helps rebuild that bucket. So it makes you more efficient and gives you a bigger capacity. It helps reduce inflammation as well, that has been associated with cancer-related fatigue, but it's also been associated with cancer recurrence, treatment completion, and outcomes like that. So not only are you going to help fatigue, but you're going to help some other things that you really care about. It can also improve sleep. So, sleep is something that can obviously contribute to fatigue levels. So, we can target it through that way. And exercise can also improve mood and cognition. So, there was a recent study that came out in sort of general population with anxiety or depression symptoms, and 30 minutes of exercise a day was actually more beneficial than taking an anti-anxiety, antidepressive medication. What else can exercise do just quickly? And this will be all I'll talk about it because I'm trying to stay very focused on fatigue, but it's shown to improve survival by up to 40% in some cancers. It can improve response to treatment, and there's some really cool stuff in some upper GI cancers like esophageal and pancreatic. It can improve surgical outcomes. A lot of that's been in sort of stomach, gastric, and esophageals, and a little bit in pancreatic. It can improve other side effects, improve quality of life, and it can reduce risk of recurrence. So, what is exercise and what are we talking about? So, there's two key main ones. One is aerobic. So, this is the walking that a lot of you are doing, dancing, swimming, cycling, boxing. So, anything that's cyclic, as little as 10 minutes a day has been shown to be beneficial. So, I'm not talking about big 1 hour walks. I would much rather you go on a 10-minute walk every day than wait till you feel better and do a big 60-minute walk that day, because that's going to contribute to that boom bust cycle. And on a side note, this is where a lot of my PhD research has been in, but 10 minutes alone has shown to release cells in your body that have been shown to make treatments like immunotherapy work better. They've done this in a pancreatic cancer study and also suppress cancer growth in petri dishes. The key, though, is that we get a little bit breathless. And this breathlessness actually triggers the release of cells to have all of these really good things. The good news is that this breathlessness is relative. So it doesn't have to be the intensity of what made you breathless before cancer. It doesn't have to even be what made you breathless last week. It is what makes you feel a bit breathless right now. So moderate to vigorous is what's in these exercise guidelines. So moderate is speak in phrases before you have to take a breath, about 5 to 7 out of 10. High intensity, and I don't recommend we start at high intensity. We try and start at this moderate, is just sort of words that more 7 to 9 out of 10. Things that are really good for that is like finding a hill and walking up a hill, then taking it really, really, really easy to come back down. Another one that I loved, I had one client sit down and say, I hate exercise. Good luck. My oncologist said I should see you though. And she has ended up every morning picking 4 favorite songs for the day and dancing to them. So she'll dance and sing in her living room to the song. She'll pause, change the song to the next one, get her breath back, and repeat that a couple of times. So it doesn't matter what exactly you do, as long as you're a little bit breathless and you enjoy it. And as little as 10 minutes is worthwhile here. And that's where I start a lot of people who might not be doing anything and really struggling with high levels of fatigue. The next thing is resistance training, and this often gets overlooked by a lot of people. But when we're at the early stages of this process, building muscle strength, I hate having to say this, but if someone made me pick what was more important for someone with really high levels of fatigue, I would say let's start with a bit of strength training to build your muscles capacity. This doesn't have to be crazy. This can be something done at home with a band. This is my grandma, Valerie, who I spoke about earlier. She's 89 in this picture and she's 92 now and still cancer-free and alive, doing a banded row on her balcony at home. It can be exercises done laying down. It can be exercises done in a gym. The only thing is that it needs to be targeted to you and your energy and a little bit progressive in nature. Otherwise, we'll kind of stay the same. This is Marty. He had stage 4 pancreatic cancer when I first met him. And when I asked him to give me a bit of a quote, I really loved it because, firstly, he spoke about how exercise gave him something to aim for, something that gave him control, and something that knew would help his side effects. He always walked away feeling better. He never thought that exercise would be the one thing that would help his fatigue, but it did. He loved coming to the group because he knew everyone understood what he was going through and he wasn't just another person. And he'd recommend exercise to everyone throughout their treatment. So, how can we all start doing this? Firstly, 10 minutes counts. 10 minutes is enough to make a difference. So, starting there, breaking it up. So instead of aiming for this big 30-minute or 60-minute session, breaking up 3 10-minute blocks throughout the day can be really, really useful to help energy and help it even just be something in your brain that seems achievable, and also fitting it in with everything else there is to do in life. An interval approach is almost always where I start with. So, for example, walk for 2 minutes, sit down, stand under a tree, rest for a period of time, and then repeat. It helps build capacity without overdoing it. If you have a window in the day where you've got a bit more energy, choose that. I find it's about mid-morning for a lot of people. The other thing is picking times of day, morning and evening, where it's not as hot. Strength matters too, and I really, really want to drill this one in. So doing something to build muscle is really important. And the goal here to start with is about consistency. So if we're not able to do that moderate to vigorous to start with, that's okay. Let's try and be consistent. So it's not about duration, it's not about intensity to start with when we're trying to make some of these changes with fatigue. It's about let's just pick something and do it each day. And often I find once you've done something, sometimes for some of my clients, I always start off with a floor mobility and a floor strength circuit. So you literally can lay down and not move, and then doing something makes them feel a little bit better. So then the standing circuit becomes something that's achievable. And that's exactly what I gave to the gentleman I was talking about yesterday with the really bad fatigue that came in with his wife. So I'm not sure how interested you all may be in this part. Sometimes I get really good interest and sometimes people huff and puff and groan, but I wanted to show you how simple it might actually be to do something at home. So I'll give you two options here. You can either watch me show you some home movements you could do to firstly aerobic, get your heart rate up a little bit breathless, two strength exercises, and then I always include a little bit of balance, particularly if you've had chemotherapy and peripheral neuropathy and those types of things. Would anyone like me to show you these exercises and or join in, or you think you'll be on this level and I'll move on to a bit of question time? Put your hand up if you would like, or say something in the chat if you would like me to go through any of this. A hand, I've got one hand, that's all I need. All right, let me push this back. So and I might just turn the blur off. What I really wanted to show you is that it can be simple. You don't need fancy equipment, but what I do recommend is seeing someone like one of the girls at Valere or another exercise physiology clinic to help tailor this to your situation and your energy levels. We do telehealth, so it can help anyone around the country, particularly if it's more about a plan and guidance. The first one is aerobic, and the beginner level is marching in one spot. So this is the entry level, and this will get your heart rate up. So something I do is a bit of interval. So you might do a minute of marching, 30 seconds rest. To make this a bit harder, we can go to high knees on the spot faster. And to make it even harder, we can pick the knees up for high knees there. So that's number one. That's really good for cardio. I already feel a little bit breathless. The second one is for people that might have any aches, pains, lower limb injuries, boxing arms. So punching, you can do this standing. You can, of course, walk, run, swim, ride, but this is just something at home to do there. Strength, two simple exercises. I chose standing just so people didn't have to get down on the ground, but there are ground options here. So the simple beginner option is a squat. So bend the knees, sit the bottom back and stand. If this is easy for you, the option is we can do a bit of a staggered stand. So I'm just going to come back this way. This is where you bring one foot back and it's really, really light. And then we have most of our weight on our other leg and we bend the knee and we stand up. If both of these are a bit too challenging or we're getting any knee pain, maybe we need to see an exercise physiologist to help fix the knee pain. But a wall sit is my other option here. So you can come against the wall, hold, you'll feel your quads burn pretty quickly. If you like multitasking, grabbing a little weight and we can do something like an overhead raise to work the upper body at the same time. Wall shoulder tap. So you can either do this on an incline like a table where we tap, tap, tap. You can do this then on a wall where it's a slightly easier variation. You really want to start challenging yourselves, we can add a push up in. So you can push up, tap, tap, repeat. If they're still too challenging, we've got the ground. Then the last two are the balance examples. Let me just get my camera up again. Yep, so I can make sure you can see my feet. So we have a tandem walk. So this is where we go heel, toe, trying not to look at our feet, looking straight ahead. To make this one harder, you can then go backwards. To make this harder again, we can do a high knee, pause, step. And last one is mixing a bit of strength up as well. So you can either stand, narrow stance is level 1. Level 2 is that heel toe. Level 3 is that single leg. And we're going to add an arm raise in. I like to challenge brains a little bit too in the clinic, and we do opposite arm movements. And to turn it into an upper body strength, we can hold those dumbbells in hand as well. So there's 6, and if we count all the progressions, probably 12 to 18 exercises that could be put in a bit of a program at home from a cardio and a strength perspective that can be done in 10 minutes or could be done more times to be done in 20 minutes. I just wanted to give you an example of how simple it could be at home and low cost, because I know cost adds up quickly within cancer. But I do recommend getting some guidance just to help tailor it to you, which is what my next slide kind of is about. So I recommend, if I had my way, everyone with a diagnosis of cancer would get at least one session with an exercise physiologist to help educate and help give you some targeted advice on what not to do, how to pace things. Again, happy to help you, A, find someone in your area, or B, help Valere to help you either face-to-face or via telehealth. Some questions I always advise people to ask when you're trying to find someone is, have you worked with people with cancer before? What's your approach to fatigue? Like, how would you manage it? Because it's easy for someone just to say, yes, I have. I probe a little bit more. Maybe I should be more trusting, but I like to ask a few more questions. What types of cancer have you worked with? Because I think upper GI cancers have some unique characteristics about them that does need someone to help manage and understand. And something I find really great is group classes. This is one of my big groups carrying me on my birthday a few years ago, their strength workout, because it gives you a connection point to other people that are going through something similar. We run 15 group classes a week, all cancer specific, and I've seen all sorts of friendships form. They go and have coffee after. Sometimes it's like pulling teeth trying to get them to exercise and not talk. There's resources online. Pancare have pretty well the best, I think, out of all the non-for-profits on their exercise resource. Cancer Council also has a resource specifically on exercise and fatigue. Start small, track things. And I've already touched on that group program. And the other thing that you can discuss with some of the PanCare nurses is they do offer some funding support if needed for an initial with either myself or another clinic down in Melbourne. Speak to your GP about a care plan. So there are Medicare referrals on offer, Medicare rebates for exercise physiology, and group classes are also a more affordable way. So I have a group class. You won't find this probably anywhere else in the country, and I probably shouldn't still do it, but I have a group class that's only $18. It's a bigger group class, the one that's pictured there, but my more specific ones are 45 minus private health rebates. So you get an idea on kind of costing. I am on the cheaper end. We do also at Valere offer just a free 15-minute phone call if you do just want to chat to someone to help you find in your area someone with experience that we may know or had a quick question on this. And that is me done.
Thanks so much, Morgan. Thank you for your time today.
Bye.